Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, and I'm here with special guest, Dr. Fatima Syed. And today we're going to talk all about hormones. So, Dr. Syed, I just want you to introduce yourself.
Absolutely. So it's nice to be here. I am a primary care doctor, a general internist, did do training in endocrinology, and really like hormones. Found that I could do a lot of that in primary care. So that's why I work as a general internist. And I am an academic clinician in Durham, trained at Virginia Commonwealth, Jefferson, and Philly, where like is a big transient city for a lot of people.
I've been there too.
Yep. And now we're in the lovely triangle. So thanks for having me.
Yeah, and you're a mom of 2 kids and soon to be 3.
Yes, exactly. Yeah, that's a big part of things also.
Lots of hormones going on too.
Lots of hormones. So excuse my anger if that comes out. Lots of hormones, lots of skin things happening, as you know, as my dermatologist. So.
Absolutely. All right, so let's get into it. So as you may or may not know, hormones have a huge impact on the skin. And I think that this episode is great so that we can actually talk about the hormones at the basic level and how they apply to dermatology. So let's dive right in and kind of go into, specific hormones and, what they do and how they can potentially impact the skin.
Absolutely. Yeah, I think that's a great place to start. And there's a lot out there with patients that I think patients read about, and then there's going to see your physician and ordering labs. And then sometimes there's like a disconnect of what matters and what doesn't. So I often get patients talk to me about like, I think my hormones are off.
I hear that all the time.
Yeah. And I think that makes sense. That means that there's something going wrong and we're attributing it potentially to some endocrine or hormonal issues. But it's important to sort of understand like what that means. And what can be corrected and what can't. So like when we think about hormone, it depends so much on symptomology, and then that can drive like how we prescribe things or how we decide what labs to check or not check. Sometimes patients come in and they're like, I want my hormones checked. And that's such a tough thing to do because it really, again, it's all about what I tell students too. It's all about your history. You can get so much from the history of what's relevant and what's not. If it's helpful, we can maybe talk about like certain patient scenarios as well.
Sure.
So, I think of a patient I see very often is patients who are approaching perimenopause or post-menopause. They're starting to get changes in their hair and their skin. Their cycles are starting to get irregular, and they're like, I want my hormones checked. And oftentimes, right, it may not change the clinical course. So they may get a little bit of pushback from their clinical providers saying like, I mean, we can check it, but we also, it may not be relevant to the course of what we can do. And I think there's merit to that, but at the same time, we also have to work collaboratively with our patients. So in that patient, I'm interested in their estrogen levels. I'm interested in the reason I like endocrine is because there's just a bunch of little chains that one turns on another turns on another turns off the other. It's kind of easy to think about. So I'm interested in the hormones of the brain that are telling their ovaries to make hormones or not. I'm interested in their testosterone levels. I'm interested in progesterone, their LH and FSH, the hormones of the brain. Also their thyroid. This comes really relevant in patients who might have irregular cycles and PCOS. So, and also in patients, in our male patients, interested in their testosterone, their thyroid, all kinds of things. So it's really important to really delve into the history, and then you can kind of figure out like, where do I go from here?
Yeah, so, the approach where people are just ordering a whole panel of labs, it's really hard to interpret sometimes.
It's really hard to interpret, and it's also like very accessible, which it's really cool that there's so much health access at our fingertips in a lot of ways, but then people don't know how to interpret those things, and that's where you kind of get stuck. So I think it's really important to work with your physician or whoever you're seeing to be able to kind of think about next steps.
Yeah, exactly. And then these hormones aren't just isolated, like they are affecting the whole body.
Exactly,
And there's a
exactly.
complex interplay.
Yeah,
So it is a
yeah.
lot. And
And you
that's
can,
why I always respect the endocrinologist. I always found it fascinating what you guys
absolutely.
do and how you can really improve
Yeah,
someone's health.
yeah. And you can definitely like be able to put pieces together in a
Hmm.
way as well. Like, for example, I've got some patients who I might see for weight management or just in general, and they didn't know that they had PCOS
Hmm.
because they were able to mask their insulin resistance. And I know we'll talk a little bit more about that as well, but they were able to mask it through their life because they exercised a ton or
Yeah.
whatever. They were able to lower it naturally. And then they're in their 50s and 60s, and I'll really delve like, tell me about your cycles when they were happening.
Mm,
And no one's really asked them those questions in like 10 or
interesting.
20 years because it hasn't been
Yeah.
relevant. Or did it take you a while to get pregnant? That sort of thing.
Mm,
And then we find some of their skin findings, like PCOS doesn't just end because you go into menopause.
yeah.
You may still have the manifestations afterwards. And so again, I keep saying like it's just those conversations are so important.
Yeah, absolutely.
Yeah.
So that's great. I mean, like we talked about estrogen, testosterone. There's some other hormones that we
Yeah.
typically see. You mentioned thyroid disease
Yeah,
as well.
absolutely. So, talking about the thyroid, sometimes, patients may have hair thinning,
Mm,
that they may find that their nails are more brittle. And then they might have other symptoms like they're feeling more cold or it's gaining weight and they don't know why, or they're feeling fatigued or off. And that points me towards hypothyroidism. Hyperthyroidism has the opposite symptoms. So, feeling like your heart's palpitations.
mhm.
They might have some changes in the appearance of their eyes. That points me more towards hyperthyroidism. They may have more hair shedding as well. So, depending on where the patient's symptoms are, we might sort of check those things. And often, like if I'm getting meeting a patient for the first time and there's a lot of things going on, I'll probably check a lot of different things.
Mhm.
Like for PCOS, we call polycystic ovarian syndrome. That is a disease of basically excluding other things. So there's this thing called the Rotterdam criteria, which is basically irregular cycles plus either acne or unwanted hair. That alone can help me diagnose
Mhm.
it. But the reason we do lab work is to make sure there's nothing else going on. So we check the testosterone, make sure there's not a tumor secreting testosterone that could
Yeah.
explain symptoms, DHEAS,
Mm,
cortisol levels, making sure that there's not a hormonal issues from in utero that are impacting
yeah.
things. So again, based on the scenario, we may check different things.
Yeah. So let's dive into some other, conditions. So acne and hormones.
Yeah.
So I see that a lot in my
Oh yeah.
practice, and we talked about PCOS. So tell me how you approach your patients.
Yeah, absolutely. First, I think it's really important to know what you know and then know what you don't know.
Mm.
So if I need to phone a friend in dermatology, as you know, I will phone
I
you
got
and
you.
send patients your way, or to other dermatologists as well. So if I've got a patient who's got PCOS and I know that they have PCOS, PCOS is a disease of insulin resistance, and it'll be helpful to explain what insulin resistance means. So basically, insulin is a hormone that's secreted by the pancreas. Its job is to get sugar to go from your bloodstream into your cells. And sometimes that can be hard when we're carrying extra weight or we have natural disposition to be insulin resistant if we're South Asian. So,
Yeah.
all of us,
Definitely.
or you've got family history of diabetes or whatever reason. And so PCOS can have a whole constellation of symptoms. Irregular cycles, like we talked
Hmm.
about, unwanted hair, like we talked about, acne, but it can also be like hair that's thinning or shedding or,
Hmm.
androgenic alopecia, things along those
Yeah.
lines. And that's where I try to address the underlying hormone issue with diet, exercise, medications.
Hmm.
And if we're still having the skin manifestations, or if we just
Hmm.
want to, get in with someone, I'm like very quick to say, let's get a
Yeah.
dermatologist involved. Why
Yeah.
why delay getting the right care?
Absolutely.
So PCOS again. So the skin findings we might see is the signs of insulin resistance. So like
Hmm.
darkening, acanthosis
Yep.
of the neck, again the unwanted hair, or like the darkening of the skin and like melasma or that patchiness as
Yeah.
well. And again, if we can lower that insulin resistance, we see such improvement in symptoms.
Yeah, it's huge. I mean, I see so many patients on a daily basis
Yeah.
with all these manifestations of insulin resistance, and they have no idea.
Hmm.
Absolutely no idea. I'm like, when do you
Exactly.
see a primary care physician?
Yeah,
When have you seen an endocrinologist? And many people just don't know. And
exactly.
they're actually literally coming in for like this hyperpigmentation on their neck. They
Yeah,
can't those nigricans.
yeah,
Like, oh, like I keep getting my, unwanted hair waxed, like I'm getting
exactly.
annoyed with it.
Yeah,
I'm like, we need to do a deeper dive and seeing like, hey, what is the cause of this?
absolutely.
And I think that's where we can do, a lot for our patients. So
Absolutely.
many times they're going to me as the first step as a
Yeah, yeah,
dermatologist. And I'm like, hold on. I mean, I can help you with all these things, but we really need to partner with your primary
exactly.
care physician,
Exactly.
endocrinologist,
Yeah.
your OBGYN, and make sure that we get you the proper help that you need because,
Absolutely.
like, insulin resistance has a lot of serious
Yeah.
consequences.
And we're so specialty focused in
Hmm.
medicine, right? That like everyone's in their own silo, and then patients can also access different specialties without having the anchor. And I think
Hmm.
that anchor, that general internist, family physician, that primary care is so important to like put things together,
Yeah.
just so that you can address some of those things as well, or seeing an endocrinologist if that's the right step as well.
Yeah. I want to get your thoughts on spironolactone. That's one of our
Yeah.
favorites in
Yeah, yeah,
dermatology.
yeah, yeah. So spironolactone works really well for hormonal acne.
Hmm.
I think that, I'm an internist, so I'm obsessed with potassium, right? That's what we like. Half of what we talk about is go hours
Yeah.
about potassium pathways.
Hmm.
But obviously, you just want to make sure you're following up with someone about lab work.
Hmm.
It is a diuretic. Diuretics do have side effects.
Yeah.
And so you have to talk about like the risks, benefits for people.
Yeah.
Obviously, you don't want to take it if you're thinking about having a baby because you don't want to
Hmm.
impact the hormones of the baby
Yeah.
either.
Yep.
I think it works really well
Mhm.
for the right cases. But again, we
Mhm.
have to know the history. Like,
Yeah.
is your acne particularly cyclical?
Mhm.
If so, if it's around your cycle, then spironolactone is a really great medicine.
Yeah.
But if it's not, like
Yeah.
it might not be the right medicine for
Yeah.
you, and why put you through
Yeah.
a diuretic if you don't need to be
And
on one?
interestingly, there's been a huge push to topical
Yeah.
spironolactone and
Yes.
other like androgen blockers, and that has
Absolutely.
been a new option for a lot of patients. And you
Yeah.
can use it male and females
That's
without
awesome.
getting those, side effects, unwanted side
Yeah.
effects for
Yeah.
the males
Can
especially.
I ask you about topical estrogen? Because I actually
Yeah.
want to learn a little bit more about that myself.
Yeah, it's pretty remarkable. Like we see a lot of anti-aging properties because, as you know, estrogen, there's estrogen receptors in our
Yeah.
skin, and those topicals can really help rejuvenate the skin,
Yeah.
helps with, collagen synthesis and other peptides that are formed in the skin, and
Hmm.
it's pretty remarkable.
That's great.
And we've had a lot of patients ask
Yeah.
about them, and you can get them compounded,
Hmm.
and I think that especially for our postmenopausal women
Yeah.
who are looking for rejuvenation, it's been a game changer.
That's wonderful.
Yeah.
And it's okay because the other thing I think about, again, with my internist hat is there's some people who cannot get
Yeah.
oral estrogens,
Hmm.
and those can be helpful in patients with PCOS. But let's say they have history of migraine with aura. We
Hmm.
don't want to increase their stroke
Yeah.
risk. So that's an option for
That's an
those
option.
patients.
Yeah.
Okay,
Yeah.
wonderful. Like
Yeah.
the safety profile of that.
Yeah.
Yeah.
Yeah. So it's like not filtering through your whole body and everything.
Exactly.
So you can kind of
Exactly. That's
localize
great.
it. So
Yeah. Yeah.
yeah, it's an option.
Yeah. I mean,
Yeah.
we've been using it on the GYN side of things for a long
Oh
time, help
yeah.
people like prevent getting urinary tract infections, that
Yep.
sort of thing. So that's great.
Yeah, that's cool.
Yeah.
So going back to PCOS,
Hmm.
so like in dermatology, we see a lot of patients with acne, but we're also seeing, that hirsutism,
Yes.
which is that
Yes.
unwanted hair.
Yeah.
And many of them are coming for us, hey, for strategies to limit that.
Hmm.
So,
Hmm.
what I do in my office, I use a lot of laser hair removal.
Yeah.
It's safe, it's effective. Um, I don't know what your thoughts are. I mean, do you think that, destructive methods for removing hair,
Yeah.
unwanted hair, is a good thing? Or do you find that when patients are properly treated for their hormone
Hmm.
imbalances, that tends to go away?
I think it tends to improve. It may
Hmm.
not go away entirely, but
Yeah.
if you can lower that insulin resistance again through diet, exercise, medications like metformin, maybe
Hmm.
regular cycles with birth control, it can definitely improve.
Yeah.
But I think laser and the old school methods of electrolysis in
Hmm.
particular, laser is less painful. Electrolysis is absolutely more painful, but it is
Yeah.
something that can offer a permanent solution. Because think about like if you're 20 and you have to
Mhm.
get threaded or waxed
Yeah,
like every week or shaving, like that's a big thing on your mental health as well
it
if it's something
is.
that you
Yeah.
know that disturbs you. So
Mhm.
I'm a big advocate of,
Yeah.
plug into these things early, and why put yourself through more than you need to.
Yeah. And then, that topical medication. I don't know if you heard of it, Vanica in the past.
Yeah,
Yeah.
it's supposed to slow hair growth, but I've
I
never found
really
that it
have not.
worked.
Yeah, I
Yeah.
agree. Like, it's just like nobody's really satisfied with it.
Exactly. I remember actually when it came out
Yeah.
in the 90s and I was a kid. And
Mhm.
as you know, like in our population, unwanted hair and
Yep.
PCOS is like a
Mhm.
big thing.
Yeah.
And I remember like the aunties being really excited about it. And it was really expensive. And then it
Yeah.
didn't help very much. So
No.
and you've got to mostly pay out of pocket for it.
Yeah,
So
and actually it's been off the market
yeah,
and now it
has
just
it?
has to be
Okay.
compounded. So
Okay. Okay. If it's not helping, and I don't see the point,
yeah,
basically,
I would
yeah.
say use that money and,
Get
do laser
laser.
hair
Yeah,
removal.
absolutely.
Yeah, it works so
Absolutely.
much better. Yeah. All right. So one of my least favorite topics, hair loss.
Yes.
So it's not that I don't like it. It is
Yeah,
just so
it
frustrating and
is.
it does require a lot of detective work. So,
Yeah.
I mean, do you see hair loss in your
Yeah, I'm
practice?
usually the
Yeah.
first person that people talk to about
Oh,
hair
yeah.
loss. And it's really tough. It's tough for everyone. It's tough for our
Mhm.
male patients. It's tough for our female
Yeah.
patients. It's something that people really struggle with.
Yeah.
And so I do a hormonal workup on folks. I will say, like, it doesn't always help,
Yeah.
right? And so I may be able to correct the hormonal imbalance, but there are so many other factors that go
Mhm.
into hair loss,
Genetics. Mhm.
genetics, stress,
Yeah.
all of those things. So I have like a lower threshold to refer early to dermatology of
Yeah.
like maybe you need a scalp biopsy if
Yeah.
that's something that you would
Yeah.
recommend. Like maybe there are other things outside of the box that we can think of
Yeah.
because again, all of those things can really impact a patient's mental health.
100%. Yeah.
And so I am a big fan of let's not dismiss it. Let's just say this bothers you enough. Let's
Yeah.
phone a friend on
It's
this.
important. I mean, it does play a huge role on a person's sense of self,
Absolutely.
identity, for men and
Yeah,
women.
absolutely.
And, if it's something that you're self-conscious about, I mean, we have a lot of science and a lot of tools to help our
Yeah,
patients with, but it is complicated
totally.
sometimes. And then
Totally.
we have to kind of really determine what the cause is. If it's androgenetic alopecia, then, yes, we can help a little bit with, balancing hormones, but a lot of it's genetically predetermined.
Yeah,
So we have to use
exactly.
certain tools for
Yeah.
that. Whereas if it's, alopecia areata, that's more autoimmune.
Yes,
If
exactly.
it's an inflammatory scarring alopecia, that requires a
Yeah.
totally different type of
And there
treatment.
may be other health things going
Yeah.
on, right? In alopecia areata, like
Hmm.
perhaps there's other autoimmune things going
Yeah.
on that we need to maybe
Often thyroid disease. Yeah.
exactly,
Yeah.
exactly, but we may need to loop in a rheumatologist. So we have to look at the
Yeah.
medical side of things as well. I would say
Exactly.
don't ignore it when it's happening
Mm-mm.
because it may be indicative of something else going on in your body.
Yeah, so let's walk through like how we typically treat an alopecia patient in my office. So,
Hmm.
many times, patients already coming in with their labs, like,
Yeah.
oh, I've already gone to my primary care
Hmm. Hmm.
physician. Um, all the labs look normal.
Yeah.
So where are we at? So if I'm examining the patient, it looks like clear-cut androgenetic alopecia,
Hmm. Hmm.
where, in the males, you typically either have hair loss in the vertex by the crown of the
Hmm.
scalp
Hmm.
or in the frontal temporal area in the front
Hmm.
or in a female patient, predominantly in the front, especially with the widening of part,
Hmm.
then the way that I kind of address them is by offering, some of the FDA approved medications.
Yeah.
So for men, I, talk about minoxidil.
Hmm.
So, that helps to stimulate hair
Hmm.
growth.
Hmm.
But minoxidil is actually a medication that I use in internal medicine a lot,
Yeah,
right?
absolutely. Yeah.
So it's originally a blood pressure medicine, but we're
Yeah.
using it for its side effect.
Atypical reasons. Yes. Yeah.
So
Sometimes I see blood pressure benefits for patients.
exactly.
Exactly. Yeah.
Yeah, so I mean
Yeah.
that's a great option. You can do it topically over the
Hmm.
counter.
Hmm.
You can do oral, prescription, and it's been very helpful for a
Hmm.
lot of my
Hmm.
patients.
Hmm.
Um, However, like with any medication, there's side effects, right?
Yeah.
So with minoxidil, I always tell my patients, okay, it is a blood pressure medicine. We use really low dose, like we do
Yeah.
a 2.5 milligram tablets. Sometimes cut them in half, take
Wow.
that. So it's really low, so unlikely to
To
cause
get the dizziness and
the dizziness.
lightheadedness.
Yeah.
Yeah.
But, if you're sensitive, you always have those patients,
Sure.
so
Sure.
possible. So I always tell them about that.
And do you
Um,
look to make sure like there are other blood pressure meds if they need to
exactly,
reduce anything else? Okay.
exactly.
Got it.
But the other thing, there are rare side effects, right, with
Hmm.
any medicine.
Hmm.
So with minoxidil, I tell my patients, especially if they're taking it orally, there's that whole thing about pericardial effusions where you've gotten fluid around the heart or like swelling in the legs. So that can happen.
Yeah.
Just something I always remind my patients.
Yeah.
But minoxidil is a pretty safe medicine. It's been
And
out for a long
it's
time.
good because we're not using it for blood pressure
Yeah.
control that much in internal medicine, but
Mhm.
we're seeing it more for, again, that cosmetic reason. So it's good
Yeah.
for everyone to get a little refresher on the side
Yeah.
effect profiles. Yeah.
And then, of course, Finasteride.
Yes.
Yeah.
Yeah.
What are your thoughts on Finasteride?
I think again, like not a medicine I use outside of prostate
Yes.
hypertrophy that often, to be honest with you,
Yeah.
but it's great that those benefits are there. And so
Yeah.
I think that again, as long as we're familiar with the side effect profiles,
Yeah.
then whatever's working and evidence-based to help people, I think that's huge.
Yeah. So Finasteride, if you guys don't know, it's a medicine that we often use to treat enlarged prostate. But it's also been shown to help to retain your hair
Yeah.
by blocking the conversion of testosterone to dihydrotestosterone. That's what your hair follicles are sensitive to when you have androgenic alopecia. But, there is a rare side effect of sexual dysfunction in men. So we just always tell our patients about it.
Yeah.
I have never really seen it in my patients, and
Okay.
I've prescribed it for like 10 plus years.
Is that a medicine? Can you tell me a little bit more if like a male patient is thinking about fertility and having kids? Is that
Yeah.
anything that they need to be careful
So
about?
sometimes patients can have low libido with it, and that's the thing that I typically see with it. And some patients with low sperm counts,
Got it. Okay.
you might want to be careful about it. But many patients, I've seen have done well for decades, and they, successfully became fathers,
Yeah.
safe, healthy
Safe,
babies.
healthy. Okay.
So
Wonderful.
I think that it's something that I counsel my patients on, but if experiencing those symptoms, just stopping it
Yeah.
immediately. And then, there's topical versions of it too, which is
Absolutely.
nice.
Yes.
The nice thing
Yeah.
about dermatology is we often
Yes.
have topical formulations of things
Absolutely.
to target the,
Yeah.
actual skin. So that's
And we
that's
like
nice.
that more because then
Yes.
there's less sort of to look
Yeah,
out for as well. So that's
exactly.
great.
And then
Yeah.
we had talked about
Yeah.
spironolactone. We
Yeah.
use that for women,
Yeah.
for hair loss as well. So, and my postmenopausal women, we use like dutasteride
Okay.
as well sometimes. So
Wonderful.
those are some things that we kind of offer our patients. And then without tinkering with like, medications, red light therapy has been shown to be
Yeah.
effective, and regenerative medicine. So PRP,
Yes.
peptides,
Yes.
various different treatments are out there, exosomes. So it's really exciting to see what we can do for our hair loss
Yeah.
patients.
And it's interesting because I'll have patients reach out to me about peptides, and
Mhm.
I am less familiar with that
Yeah.
space as an internist in the hormone space. But I will say again, there are people who are doing more of these things.
Yeah.
PRP, I think, can be very
Yeah, we're
beneficial.
doing a ton of it in our
Yeah,
office.
absolutely. And you've got some new methods where it's less sort of invasive,
Yeah,
correct?
and then we
Yeah.
also have this non-ablative fractional laser system that has been shown to actually stimulate hair growth and also applying topical peptides
That's amazing.
that really reduces the pain. It's almost painless, which is
Yeah.
nice because that's one of the things people are afraid of with
Yeah.
PRP
Yeah.
injections in your scalp. It does
Absolutely.
hurt.
Yes.
But we try to make it as comfortable
As
as possible
comfortable
for
as
our patient.
possible.
But it
Absolutely.
works. Like I've seen some beautiful
Yeah,
results with
that's
it.
wonderful. That's wonderful. And again, like there's no need to gatekeep some of
Oh yeah.
these things. Like if you've got a patient, I
Yeah.
know if I have patients who are coming and
Mhm.
I've corrected some of the hormonal
Yeah.
imbalances, but there's still those issues.
Yeah.
Let's go see dermatology and see what we
Yeah.
can do for you.
And the nice
Yeah.
thing is there's nothing foreign coming into your body. They're your own growth factors for the
Mhm.
PRP. And it can be used for various types of hair loss, not
Yeah.
just the androgenic
Yeah.
alopecia. So we're also treating like people with like thyroid related hair loss.
Yeah.
We're also treating, inflammatory, hair loss. We're also treating, patients who have telogen effluvium from
Yes.
postpartum,
Yes.
which,
Things to look forward to.
yeah.
Yeah, I'll be coming over your way.
Yeah, you got it.
Wonderful.
All right, so I think that we talked a lot about the
Yeah.
things that we touch on in dermatology with
Yes.
hormones. So let's talk about what we can do with counseling patients, like
Yeah.
lifestyle
Yeah,
and,
absolutely. I think again is being aware of your symptoms and going to the doctor at the right time is huge.
yeah.
And I think what you eat matters a lot too. A well-balanced diet, an American diet is very carbohydrate heavy.
Yes.
So focusing on high protein, low carbohydrate helps keep a healthy weight maintenance as
Mhm.
well.
Yeah.
And all of those things help, particularly if you need to lose weight
Yeah.
first to lower that insulin resistance. So I think a well-balanced diet. I do get questions about anti-inflammatory diets. One of the issues is there's not as much evidence
Yeah.
because some of it isn't as studied as much of various types of diet and impact on
Yeah.
on skin and hair as well. But
Hmm.
I think in general, a well-balanced diet, emphasizing protein and less emphasis on carbohydrates, getting
Yeah.
all your greens and veggies
Yeah.
is probably, get all your colors in. That's
Yeah.
probably huge. Yeah.
Yeah. Absolutely.
Yeah.
What are your thoughts on exercise?
Exercise again, I think increasing blood flow is
Mm-hmm.
important, right? So
Definitely.
just in general, exercise is really important.
Yeah.
If there's things like insulin resistance or hypothyroidism or other issues, I think particularly for insulin resistance, exercise is going to be critical. And then for me, it's the exercise that sparks joy. So yes, like high intensity exercises and,
Mm-hmm.
the 12-3-30 is what I often recommend, which is 12 resistance on the treadmill, 3 miles an hour, and you're just walking for 30 minutes is a way to get efficient calories burned as
Yeah.
well. But like it's
You'll definitely get
also
a sweat too.
exactly, you'll get a sweat. You're
Yeah.
giving yourself a stress test. It's kind of boring. So
Yeah.
do what makes you happy is what I would recommend.
Yeah.
But I think that can be critical as well for overall just looking good and feeling good from the inside out.
Absolutely.
Yeah.
So what about when, someone is noticing like they're not feeling well,
Yeah.
they're feeling off, and a
Yeah.
lot of people are like, oh, it might be my hormones or whatnot.
Yeah.
When should they seek the care of a primary care physician or
As soon
endocrinologist?
as they feel that way, I would
Yeah.
say always start with your primary care. I had like
Yes.
a whole talk with someone about this earlier today. I would say start with
Yeah.
your primary care doctor. Obviously, if you have a dermatologist or you're able to see one, that's a place to start because we all collaborate together.
Yeah.
Like if you
We're all
see
on the same
someone,
team.
exactly, we're
Yeah.
all on the patient's team. So
Yeah.
if you think that someone needs like more of a workup, you're going to tell them to go back to their primary care or refer them to endocrine anyway.
Yeah. What about stress? Talk to me about stress.
Yes.
We all have it.
I'm sorry, I'm not familiar. Oh, stress. I mean, stress, I think, can really impact people.
Yeah.
The telogen effluvium, especially, you see and you hear about like what people's lives are like. And
Yeah.
so, one of the things I find is that people are going through stressful periods or adjustment disorder. We're establishing that they've got some sort of underlying anxiety and depression or an adjustment reaction. So, I might start them on an SSRI.
Mm-hmm.
And then the patient will tell me, like, I'm losing my hair and it's because of the SSRI. And I think it's actually because of the stress and they've
Yeah.
got telogen effluvium from that.
Yeah.
But it gets murky when we add all of the other medications
Yeah.
into the mix. So yeah, that's definitely something that can contribute to hair
Yeah.
loss and skin issues.
Yeah. But that's what I love about, primary care. You're looking at the
Yeah,
patient as a whole and the
absolutely.
complex interplay, mind, body,
Exactly.
everything.
I call it the biopsychosocial model. It's
Mhm.
your body and your physiology. It's your mental health and the world around you. And some of those things can be very stressful at various
Especially in these
times.
times.
Yes, exactly. So everything kind of can get impacted for sure.
Yeah.
Yeah.
So it's important. I mean, people are always telling me like I'm so stressed and, it's leading
Yeah.
to my acne, my hair loss.
Exactly. It
You
probably
know,
is.
it
Like
probably
it
is.
probably
Yeah.
is. And so we can do things to kind of correct what we can, but
Yeah.
you can't always correct the underlying stressors. Yeah.
Okay. So here's a controversial topic, I know, in the medical field,
Hmm.
hormone replacement therapy,
Yeah.
bioidentical hormones. What are
Yeah.
your thoughts on it?
So I'm thinking about hormone replacement therapy first. Let's do first in our postmenopausal patients. Sometimes it's the right step, but again, I need to know what all the symptoms are. Like for
Hmm.
some people, it's more autonomic, it's more localized. And so, in which case, like topical estrogens, if it's
Hmm.
more localized for vaginal atrophy, that sort of thing. If it's more autonomic and mood things, then something like Effexor is a better option.
Hmm.
I'm not opposed to it at
Hmm.
all. I think there's safe ways about doing it, but sometimes I get patients who are like, they've got hormone pellets that someone put inside of them.
Yeah.
And then there's side effects from that. And they're like,
Hmm.
oh, why do I have
Yeah.
testosterone pellets in me? Why do I have clitoromegaly and excessive
Raging
hair
acne.
and
Yeah.
raging acne and hair loss? And so
Uh-huh.
I think it has to be done in the right hand. So it would encourage folks to talk to their gynecologists, primary care doctors, and internists, endocrinologists, whoever, start
Yeah.
there
It is
for
so
sure.
complex.
Yeah.
And it's scary to see, the type of, you know, practices that are offering it that
Oh,
have no
absolutely.
training, no
Yeah.
special. I mean, this is complex stuff, and it can
Chiropractors. Yeah, like it's a big
it's
thing.
scary.
Yeah, it is.
Wellness centers. I'm like, what
Exactly.
is
Yeah.
going on here? And then patients are getting like, strange workups. They're going on
Yeah.
weird, elimination diets,
Exactly.
and
Yeah.
they're like getting sick before
Yeah.
my eyes, and it's scary.
And I think that's probably because there's probably is like a gap in the wellness space in our profession, right? Like we
Hmm.
learn sick very well. And
Yes.
so there may be a gap for patients because of that. And I want to understand that and empathize with it.
Mhm.
But then also, like, we went to school for a really long time
Yes.
and went into a lot of debt to be doing what we're doing.
Yeah.
It's not for our bottom dollar.
Mhm.
We're here for our patients.
Yeah.
And so, to go on a rant a little bit, like I do sometimes get frustrated by some of the other outside voices that are
Yeah.
kind of undermining medical care, but
Absolutely.
what can you do?
Yeah. Fight the good fight, right?
Keep fighting the good fight. Exactly.
Awesome. Is there anything else that you want to discuss?
Yeah, I think also we've talked about women a lot, so we should
Yeah.
talk about men as well.
Us
not
guys.
to ignore men, but you
Yeah.
know, hair loss is a big thing that men talk about. We
Huge.
talked about the topical options and the oral options.
Yeah.
I think also testosterone replacement. It's important to sort of understand
Yeah.
the ramifications of testosterone replacement and to
Yeah.
please do it safely. Like
Everyone wants to go on T.
everyone wants to
Everyone.
go on T. I have had young men go into heart failure because of just the wrong hormones or too much. I've had patients, there's some other weird injectable out there. I don't even know what it is, but
Yeah.
had kidney issues and all kinds of
Ooh.
issues. So talk to your doctor. Your doctor's a safe space. But there are reasons to give testosterone that may or may not have to do with the skin, right? Erectile dysfunction, fatigue, genuinely low testosterone. But for men and hair loss, that's huge. We
Huge.
love our hair.
Yes.
And so again, like, and speaking to other like primary care internist endocrinologists, like let's not discount that.
Yeah.
You know, if we don't know how to treat it ourselves, like phone a friend in dermatology
Yeah,
to say to help with that.
Absolutely. I mean, like, the hair thing with men, it's really important to us guys. I
Exactly,
mean, it
exactly.
really does play a role.
Oh,
Like,
absolutely.
full disclosure, my dad is completely
Yeah.
bald. My two brothers, I'm the middle child, so they're thinning, but
Yeah.
I've kind of kept them at bay.
Knock on wood for that.
I am deathly scared of
Yeah,
losing my hair.
totally,
So, I mean, I get it. Like, it's
Yeah.
part of your identity and how you see yourself in the
Absolutely,
world and your
absolutely.
confidence.
Yeah.
I mean, that's actually one of the reasons why Dr. Amna liked me in the first place. She's like, oh, I got like
you got a
this hair."
head of hair. Yeah, absolutely.
So it's important. So
Yeah.
we do, and
Oh,
part of,
totally.
in dermatology, like we're looking not only at the medical side, but also the cosmetic side. And it's important.
Absolutely.
being
Because it
able-
impacts mental health,
It
right?
does,
It really
it
impacts
does.
mental health. Yeah.
It really does. And,
Yeah.
restoring that confidence is one of those things that I love
Yeah.
doing as a dermatologist.
Absolutely. No, I think that's huge.
Yeah.
Great.
Well, I think we had an awesome discussion on the impact of hormones on our skin. I mean, I'm sure that there are even more interactions that we weren't able to discuss today,
Yeah.
but hormones have a huge impact on every organ system of our body,
Absolutely.
including your skin.
Absolutely.
So I'm just so happy to be able to talk with an expert
Thank
about
you.
it.
Yeah. Thanks for having me.
Yeah, and I mean, hopefully we shed some light on some of these impacts that hormones can have on our
Yeah.
skin because many people aren't aware of that.
Yeah. Absolutely.
And
Absolutely.
there's things that we can actually do to help.
Yeah,
And that's the key
absolutely.
thing.
Absolutely.
So I think that if we don't have any other questions or discussions, like I think that I'm really excited for our next episode where we're going to be talking about GLPs and diet and its impact
Yes.
on skin health.
Absolutely. Sounds
All
great.
right, awesome. Well, guys, hopefully you enjoyed this episode. It's a little different than our other
Mm-hmm.
cosmetically focused episodes, so kind of tying in both the medical and the cosmetic side. If you have questions, feel free to message us. Please subscribe, like, and until next time, Skinside Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.